An eating disorder is a mental health condition where you use the control of food to cope with feelings and other situations. Unhealthy eating behaviors may include eating too much or too little or worrying about your weight or body shape. Anyone can get an eating disorder, but teenagers between 13 and 17 are mostly affected. With treatment, most people can recover from an eating disorder. Types of eating disorders. The most common eating disorders are anorexia nervosa, trying to control your weight by not eating enough food, exercising too much, or doing both. Bulimia, losing control over how much you eat and then taking drastic action to not put on weight. Binge eating disorder, BED, eating large portions of food until you feel uncomfortably full. Check if you have an eating disorder. If you or people around you are worried that you have an unhealthy relationship with food, you could have an eating disorder. Symptoms of eating disorders include spending a lot of time worrying about your weight and body shape. Avoiding socializing when you think food will be involved. Eating very little food. Making yourself sick or taking laxatives after you eat. Exercising too much. Having very strict habits or routines around food. Changes in your mood such as being withdrawn, anxious or depressed. You may also notice physical signs, including feeling cold, tired or dizzy. Pains, tingling or numbness in your arms and legs, poor circulation. Feeling your heart racing, fainting or feeling faint. Problems with your digestion, such as bloating, constipation or diarrhea. Your weight being very high or very low for someone of your age and height. Not getting your period or other delayed signs of puberty. Treatment for eating disorders. You can recover from an eating disorder, but it may take time and recovery will be different for everyone. If you're referred to an eating disorder specialist or team of specialists, they'll be responsible for your care. They should talk to you about the support you might need, such as for other conditions you have, and include this in your treatment plan. Your treatment will depend on the type of eating disorder you have, but usually includes a talking therapy. You may also need regular health checks if your eating disorder is having an impact on your physical health. Your treatment may also involve working through a guided self-help program if you have bulimia or binge eating disorder. Most people will be offered individual therapy, but those with binge eating disorder may be offered group therapy. What causes eating disorders? We do not know exactly what causes eating disorders. You may be more likely to get an eating disorder if you or a member of your family has a history of eating disorders, depression, or alcohol or drug misuse. You've been criticized for your eating habits, body shape, or weight. You're really worried about being slim, particularly if you also feel pressure from society or your job, for example, ballet dancers, models, or athletes. You have anxiety, low self-esteem, an obsessive personality, or are a perfectionist. You've been sexually abused.
Thanks for watching. Please like, share, and subscribe.